Grief is a natural response to loss, but when it persists, it can become prolonged grief disorder, or PGD. In this video, we'll explore normal versus complicated grief, brain science, treatments, and screening tools. This is for informational purposes. Please seek professional help if needed. Normal grief typically has an acute phase lasting 6 to 12 months. It includes sadness, yearning, and a natural ebb and flow of emotions. Think of grief like waves on a shore, sometimes intense, sometimes gentle, but gradually leading toward acceptance. Most people adapt within 1 to 2 years with proper support. The intensity decreases, and life begins to feel meaningful again. Normal grief allows for moments of joy, connection with others, and the ability to remember your loved one with both sadness and warmth. Prolonged grief disorder differs from normal grief. It persists beyond 12 months with intense yearning and significant impairment in daily life. According to the DSM-5-TR, PGD requires persistent grief symptoms for at least 12 months, or 6 months in children and adolescents. PGD affects approximately 7 to 10% of bereaved individuals. It can mimic depression but focuses specifically on the loss. Key symptoms include identity disruption, disbelief about the death, avoidance of reminders, and difficulty moving forward with life. In PGD, we see hyperactivity in the nucleus accumbens, which creates intense yearning, and the amygdala, which processes emotional pain. The prefrontal cortex, which helps regulate emotions, shows reduced activity. Meanwhile, the default mode network keeps the mind ruminating. Imagine feeling that pull toward your lost loved one. That's the brain's reward system at work. PGD essentially sticks the brain in this cycle. The good news is that treatments can help normalize these patterns and break the cycle. For normal grief, support groups and counseling provide excellent help, but PGD often requires specialized treatment. Complicated grief therapy, or CGT, is a 16-session treatment that includes imaginal revisiting and restoration goals. CGT helps people process their loss while rebuilding their capacity for joy and connection. It reduces symptoms in approximately 70% of cases. Cognitive behavioral therapy is also effective, targeting the thoughts and behaviors that keep people stuck in their grief. The Inventory of Complicated Grief, or ICG, is the gold standard for screening. It's a 19-item questionnaire with a cutoff score of 25 or higher. Other tools include the PG-13 and the Brief Grief Questionnaire. These help identify when grief has become complicated. Remember, these tools are for screening only. A qualified mental health professional should always make the final diagnosis. Grief is deeply personal, and everyone's journey is different. If you feel stuck in your grief, please reach out for help. At Mindful Odyssey, we blend nursing expertise with grief expertise. Visit us at mindfulodyssey.k for compassionate, whole-person healing. Share your story, consult a professional, and remember, healing is possible. This information is not a substitute for professional therapy.